So this is day one, all right? This is your wake-up call. Prediabetes is not pre-problem. And I am Morgan Nolte, so you can just call me Morgan. I'm a doctor of physical therapy. I'm board certified in geriatrics. I have a lot of experience working with people over the age of 50. Let's get to the housekeeping things first, what we're covering each day. Again, today it's kind of an overview of insulin resistance and why that's the root cause of prediabetes. And if you have type 2 diabetes, everything that you're going to learn today is very applicable to you as well. Also, if you just want to prevent prediabetes in type 2, also applicable. You're going to learn the blood sugar standards and the root cause checklist to pinpoint the areas of your lifestyle that you can optimize to lower your blood sugar. And then my passion, my favorite part is the emotional side, the mindset side. And so I'm incorporating some of that every single day. In the past, I just had one day with EBT or mindset stuff at that time. But because it's so critical and so important, I wanted to include some every day. You're going to learn why stress is the root cause of insulin resistance. And then tomorrow, so same time tomorrow, you're going to learn your personal nutrition plan. And we're going to get a little bit more into the detail and the strategy. You will get our blood sugar spike guide to understand blood sugar spikes better and what causes them. And then also a no spike macros method. So if macronutrients are new to you, you're going to be learning a lot about them tomorrow. You'll also learn how to enjoy carbs without the spike, which is perfect for around the holidays, and then get your personal calorie and macros goal. This is amazing. Beth, again, my right-hand gal, one of the coaches on the call today, taught me this 2-minute personalized meal planning hack that everybody needs to know. And then another thing you're going to do is identify your essential pains and earn rewards of getting healthy. Now, those two things, essential pains, earn rewards, that's emotional brain training language that you'll get familiar with. And a lot of them live in the subconscious mind. We're going to bring them up to the conscious level so that you can really understand this internal tug of war between knowing what to do and still not doing it. So that's really what we're going to be bringing to light tomorrow. And then day three, we'll get even more in depth into emotional brain training, and we're going to review the biochemical differences, meaning hormonal and chemical, of being in stress versus being in joy. It's very, very interesting stuff. And then how that affects insulin resistance. And then I would love for a volunteer on Thursday to do a brain map. That's going to be identifying rewiring opportunities, sources of stress in your life. And it's a really, really cool and powerful exercise. I'll go through it live with one person, but we did provide that in the workbook to go through together. And it is so much better done together than just on your own, where you might glaze over some of the things. And then on day three, you're going to learn more about our Zigli program as well. So this is the same structure for most days. I'm a very linear person. I like to know what's coming, and I'm hoping some of you do as well. So first is science and strategy. We just covered up some of the housekeeping. We'll go over the need to know information related to the strategy side of things, like the nutrition, blood sugar, insulin resistance, that stuff. And that's good. All that's really good to know. The next piece gets even better. So that's when we're going to be talking some teaching about emotional brain training. And then the third is coaching and support. And I think this is the best part. So live EBT coaching plus live Q&A. I put time permitting on here, but like I said, I'll just stay on and answer all the questions as long as we need to. So I have 3 goals for this boot camp. Number 1, I want this to be the best free training with the most value that you've ever received. This is free, totally free. I want you to share this with someone, at least one person, maybe even 2. So that's my second goal, is that you get so much value from this and you have so many aha moments that you're like, oh, my friend needs to know that, or my cousin or my sister. So someone in your life also is struggling with their health, and you have the opportunity to help them by sharing this training with them. And then number 3, we have about 4,000 people who have registered for this blood sugar boot camp. My hope is that 100 of those 4,000 people resonate enough with me, enough with the message, and they understand that I am a leading expert in this area, not just in the strategy side, but in the mindset, and that we have a really lovely, wonderful, helpful team who is just waiting to help you reach your goals in 2026. So 100 people, we are capping enrollment this go around because we've added one-on-one coaching and it's a higher touch point program. Here's some helpful tips. Number one is the workbook. Um, I've hosted this again. This is my fourth time, so I learned from my mistakes. And one time someone said it'd be really helpful if during the training you say, hey, this is an answer in your workbook, because they were so distracted by like not wanting to miss an answer in the workbook that they couldn't fully participate in the training. And that won't happen. We're going to have plenty of time to fill out that workbook as we go. And then that little coral workbook icon is going to be there so that you know, oh, okay, there's an answer on this slide. Let me write it down. Please remove distractions as much as possible. I know that that's hard, but I am actually going to be sharing the slides and transcripts and replays for your review. And transcripts, you guys, I'm going to be honest, I am not going to go through with a fine-tooth comb and fix all the typos. That's just not going to happen. It takes a long time to do that, and it's a quick turnaround from day to day. So you'll get everything that you need to review it, but don't be a perfectionist on me with the typos. All right, number three, please engage. Be an active participant in the chat because you're going to get way more questions out of it. Again, you can ask questions anytime in the chat. My team is here to support you, and they're collecting them on the back end, and we will answer them at the end. A little bit more about me. I'm a farmer's wife from Nebraska. We live in a 100-year-old farmhouse. We're fourth generation with my son who like rides in the combine. So now I can say fourth generation. We got three wonderful kids. Dawson is 7, Leah is 5, and then Logan is 8 months. Logan is sick right now, so bless my husband. He's upstairs watching him. This is a picture from my grandma's funeral this weekend. You can hear a little congestion in my voice. It's been, kind of a stressful week or so for me, and I'm thankful for EBT to have tools to handle that stress well and still be able to show up in full authenticity and integrity with you today. I'm a physical therapist and a health coach, again, specialized in geriatrics, tons of experience in post-acute rehab and home care. And I saw a lot of end-stage diabetes, dementia, heart disease, obesity, stuff caused by insulin resistance that I'm trying to prevent now. And then I'm a certified emotional brain training provider. I started Zivly in 2018 when this little guy was just 4 months old. I think I'm a little bit crazy, but I couldn't not. I was so passionate about prevention. I had to do it right away. And that's what I do. Now we have an online course and coaching program. We help people lose weight and get healthy from all around the world. And why Zivly? It's a super weird name. It is intentional. So Ziv means to live in Croatian. I have no Croatian ties. All the English words were just taken for like the .coms. And then the LI stands for low insulin and low inflammation lifestyle. I have over 150,000 YouTube subscribers, hundreds of members, and it's been a blessing. This work is a blessing to me, and I'm really excited to be able to do this with you today. Some important dates. Again, for the boot camp, we are live every day, today, tomorrow, and Thursday at 11 Central Time, just on Zoom. And there's a bonus live training next Tuesday at the same time at 11 o'clock. And that topic is emotional brain training for sustainable weight loss. So if you're interested in the EBT side of stuff and you want even more training and, time to hang out together, you'll be getting an invitation to that. Replays will be posted within 24 hours. The link's going to be emailed to you. I'm really big on communication. And if that's not going to be true, like if it's for whatever reason going to take longer, I'll still email you and let you know, but it shouldn't take longer. All replays will come down on Friday, December 12th. So you'll have about a week to watch everything a little bit more at 6 p.m. Central Time. And then again, our Zivly program opens for enrollment this Thursday through next Friday. We only open it twice a year, and we're going to start in January of 26. So this go around, I thought, well, let's just do the enrollment now. And if you have a New Year's resolution that you're thinking about getting healthy, it's time to make the decision and not like procrastinate that. So you can kind of go into the new year with momentum instead of stuff lingering over your head still. You can use HSA and FSA funds. We do not take any insurance, but my team can drop a letter of medical necessity. If you have like obesity or diabetes or prediabetes, you can fill that out with your physician and then keep that for your records to use your HSA and FSA funds. And again, I am not going to be like blabbing about Zivly this whole time. I hate when that happens, so I'm not doing that. So what is important to you? I want to know Is it blood sugar? Is it weight? Is it both? What is most important to you that you want to address in 2026? The other thing is, what's your biggest struggle right now? Is it knowing what to do or doing what you know? So I want you to answer both of those questions for me right now in the chat. What's most important to you? Blood sugar, weight, or both? Knowing what to do or doing what you know? Let me know. And I forgot to get my other iPad or laptop to be able to look at the responses. So what I'm going to do is I can go back and forth and see them because it is very important to me to see your responses. Both. They're coming in so fast. I love it. Both Hashimoto's, stress management. Well, wonderful, you guys. The both side of it is really great. I can absolutely help with either, but I think when you're in the right place, it's just nice to know. Yeah. Lisa, I'm really interested in your feedback. You're welcome to email us any feedback too, like specifics, whatever you want to share here. Lisa said both, but blood sugar is a bit more important. Doing what I know. I've done a bunch of trainings and I'm a scientist, so I get the science behind this. And I'm super passionate about the science too. So I try to keep it a little bit higher level here, but in our program, we go way, way deeper with the science. Yeah. Marcia, what is really causing this? Absolutely. Wonderful. Here to help your son. Yeah. So Denise wants to stop taking metformin. Absolutely. No, my team again is here. Can someone drop the link again for the workbook? Usually in a Zoom meeting, we can upload files. So I'm not quite sure why that's not working. Okay. Yeah, Karen's tried so many things. Stop taking Ozempic. Yep, insulin is 10. That's great that you know your insulin, Pat. We're going to talk about that today. Great. Okay, let's get back to this. Why is it important to know your numbers? So this is Beth. She's in her early 70s now, and her doctor ignored prediabetes for over a decade and just told her, excellent labs, you don't have to do anything. And she said, but when I looked at it myself, I could see that I was pre-diabetic. And up in the upcoming slides, I'm going to talk about why physicians are routinely ignoring prediabetes. But just being here is going to empower you so much. When you know your numbers, when you understand, like someone said, and they're like, what's causing this? Well, then you can reverse engineer a plan to fix it. Because if you don't know your numbers, like your physician, it might be like Beth's giving her false hope. You're losing time to make the changes. And there's pestering things that might be getting worse unintentionally. So I want to know what your result is. One of the things in the emails leading up to today's training was if you can have your most recent lab work available, that's great because I want you to know your numbers. So I don't know. Someone sometimes if they touch the screen, this thing, I don't know how we undo that, but those lines might be there now. I'm sorry, guys. Anyways, type your numbers in the chat, and I want you to know if you're in the optimal, the normal, the pre-diabetic, or the diabetic range. So here's fasting glucose, hemoglobin A1C, and fasting insulin. Okay, so everybody type in what's your number for fasting glucose for hemoglobin A1C? Is it in the optimal, normal, pre-diabetic, diabetic range? And if you know your fasting insulin number, type that in as well. Trying to get out of here again. There we go. So you see those little green things? Maybe if I stop sharing my screen, they'll go away. And then when I share it again, they won't be there. Okay, let's see what some numbers are here. Yep, 8.2, type 2 diabetes, pre-diabetic, still take meds for diabetes. So it's kind of like you took meds and now you're down in the pre-diabetes range. Mm. Yeah, I had a dietitian tell me not to worry, would become diabetic, but there were drugs for that. Oh my goodness, that is such a common experience. I'm sorry that you had that. Great. Okay, so a lot of prediabetes, but some diabetes here. Great. Way to go, guys. Way to go for knowing your numbers. The next question is, how long have you been in that range? So, like Beth, she was in the range for 10 years and didn't know it. So, if you know how long you've been in that range, go ahead and put that in the chat as well. How long have you had this problem? So, 5 years, 2 years, 1 to 2 years, several years, four, at least five, six. Was anybody blindsided when you went back and looked at your labs to see how long you'd been pre-diabetic, or have you been aware of this the whole time? I'm kind of like, yes, yeah, aware, aware. Hmm, that's fine. Yep. Someone asked what should my numbers be. I'm going to share my screen with you. Hmm. Yeah, there is some side effects for sure with metformin. You're not wrong about that. Okay. I'm going to do this because I want to be able to see the chat without going back and forth. So there's the numbers again that someone needed to see. Okay. We kind of talked about how long we've been in that range. That's kind of a bonus. Oh, that's great. Stephanie said hers was in the 200s for a few years, just got it in the 100s. Congratulations. That's great. Yeah, someone said, I think I was normal until I hit menopause. We'll talk about why that is. So, in your notebook, this is something that I want you to write down. Insulin resistance is the cause of high blood sugars. That's very important to know. Insulin resistance. Yeah, menopause, me too. I haven't been through it, but I've heard some stories. Okay, someone had such a wonderful question. While you guys are writing that down, if you're optimal for glucose and A1C, but insulin is sky high, what could that mean? You're pre-diabetic. That's exactly what that means. And I will show you that right now. Fasting insulin predicts type 2 diabetes up to 20 years before diagnosis. What that means is your fasting insulin rises in the background because one of insulin's job is to maintain healthy blood sugar levels. But if you're becoming insulin resistant, your body's resisting that effect of insulin. It takes more and more and more to keep your blood sugar stable. So blood sugar and A1C are a downstream effect. We really need to check fasting insulin. It is not standard of practice yet. So I want you to write that in your workbook. Fasting insulin predicts type 2 diabetes up to 20 years before diagnosis. So insulin can be rising, 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 rising for 10, 20 years. If you're not checking it, you have no idea. And then the dominoes will start to fall. And that's when you're going to see a rise in your hemoglobin A1C and fasting glucose. Okay. Now, there are different ways to check your insulin. We sell at-home tests. It's like a finger prick. It's not available in New York because they have their own rules and regulations. You need a doctor's order in Maryland and California. Otherwise, anyone in the States can get it, and we ship it internationally as well. You can also go to this ultalabtest.com. By the way, these are clickable links. So when I send you the replay, you can open the slides and just click the links and it'll open it up. That's where you can order one. You can walk into a Quest lab, but just be sure there's one around you. We live like 30 minutes away from the closest grocery store. So driving all the way up into Omaha to get my blood checked is not a thing. That's why I wanted to get the at-home test for people who are rural. Okay. So when we talk about checking fasting insulin, I always like to give people a heads up. You might have some resistance from your physician about this. One of our Zibly members asked for a fasting insulin test from her physician, and this was the response that she got that she sent to me. I'm not really sure what a fasting insulin test is. I reached out to some colleagues in endocrinology, and the only time we check insulin is when someone is an insulin-dependent diabetic. So that's a problem. They also said insulin resistance isn't something that can be reversed, which is incorrect. As you just saw in the comments, someone's brought their blood sugars down from the 200s to the 100s. You can reverse this. When you're lowering your blood sugar, when you're lowering your blood pressure, that's a sign that insulin resistance is actually reversing. Okay, So let's move on to the roles of insulin. I'm going to cover these very briefly. So the first that you can write in your notebook is nutrient conductor. I want you to think about insulin like the conductor of an orchestra. So it tells the food that you eat what to become in your body. For example, if you're having steak, which is cow muscle and dietary protein, that's going to be broken down into amino acids, the building blocks, okay? Insulin is going to tell those amino acids you need to go ahead and become muscle or become nails or skin or hair. It's a nutrient conductor. Now, another role is blood sugar regulation. So write that in your notebook. Blood sugar regulation. That's a big role of insulin. Let's look at this. This gray thing right here is a cell, just any old body cell. We can pretend like it's a muscle cell maybe. And this receptor here is the insulin receptor. Insulin acts as a key, okay? When insulin binds to the cell membrane, this navy thing here, that usually hangs out inside the cell, but it comes up to the cell membrane surface and acts as a tube slide for the glucose to go from the bloodstream into your cell, okay? So when you eat food such as carbohydrates, those get broken down into the simple sugar called glucose, one of the simple sugars. That's going to go down the tube slide because insulin has bound to this cell. Now, once it's in there, let's say you're going for a walk or you're exercising, well, you're going to use that glucose for energy. Another thing that might happen is it might get stored in short-term storage of your liver or your glycogen in your muscles. Okay, so glycogen is short-term energy storage. Blood sugar regulation. Insulin binds to the cell. This, it's called a GLUT4 transporter, comes to the cell membrane. Glucose comes into the cell. Another thing is fat creation and storage. So let's say it was Thanksgiving, right? Holidays are coming up. Let's say you're having more carbohydrates than you're burning off through exercise. What happens to the extra? So excess carbohydrate consumption maxes out glycogen stores in your liver and your muscle. And that's going to lead to excess glucose that's taken to adipose or fat tissue to be stored there as fat. Okay? Yes, of course, Lynn, and you're correct. Tomorrow I will be sure to go get my iPad or a different laptop so that I can see the chat. But yeah, it's probably fine for some of the slides, but for some of them it is helpful to have full screen here. So I'll do that. Thank you for that feedback. So again, fat creation and storage, that is another role of insulin. So what happens when insulin is high, like someone who mentioned in the chat, I have normal glucose, normal A1C, but my insulin's high. Well, you're becoming insulin resistant. So the receptors don't work as well, essentially, so more insulin is needed. But ultimately, if insulin isn't really working at the cellular level very much, a few things are going to start to happen. Number one, the glucose will have a harder time going from your bloodstream into your cell. That's why you're going to see high blood sugar. You're measuring the sugar in your blood, not in your cells. So if your blood sugars are going up, you can already tell that you're insulin resistant. Another thing, more fat storage. Insulin, when insulin is high, you can't burn fat. It's like it just doesn't work. But when insulin is really low, you can burn fat. And the best example of that is a type 1 diabetic, so someone who doesn't make any insulin at all. That used to be called the wasting disease, where they couldn't keep any weight on and they would just waste away because they would eat and eat and eat, but the energy couldn't get into the cell because there was no insulin to unlock it to let the energy in, so they would just excrete it all out. So when insulin is high, we store fat. When insulin is low, we burn fat. What else happens? Inflammation. If you had a bunch of carbs over Thanksgiving, I'm guessing, and you have joint pain or inflammation, did you wake up the next day and feel bloated and puffy and like you were more achy? If that was your experience, type yes in the chat. When insulin is low, we actually have less inflammation and our joints will feel better. And then another thing, of course, is water retention. So through different mechanisms, insulin will cause more water retention. And that's hard on your kidneys and that's hard on your heart over time. Often, even before high blood sugar, high blood pressure is the first sign of insulin resistance for many people. They might not have a blood sugar issue, but if you still have a blood pressure issue, that's a big sign that you might be insulin resistant. When insulin is low, we tend to have healthier heart, healthier kidneys, and less swelling. Why do I care about this so much? And how did all these pieces come together for me was when I would do a chart review for someone when I was in physical therapy, there was a cluster of acronyms, all indicating different chronic diseases, heart disease, diabetes, altered cholesterol, um, obesity. And I thought, well, there's got to be a root cause here. All of these can't just pop up independent of each other. They were all clustered. And insulin resistance is really the root cause of so many of the things that I treated in geriatric PT. So, osteoarthritis, for example, used to be caused, they used to think it was a wear and tear disease. It's not, it's a metabolic disease. The cells in your joints become insulin resistant and they produce inflammatory chemicals instead of healing, like the synovial fluid of the joint. And instead of the cartilage covering the joint, so they roll smoothly against each other, causes inflammation and deteriorate, like it ruins the joint health. So, yeah, wear and tear might be part of it, but it's also metabolical. And they're also discovering that for things like certain cancers and certain types of dementia. Really, really important for your long-term health to reduce insulin resistance. And you are not alone. The statistics show that 88% of adults in America have some degree of insulin resistance. And I was boggled by that number. Almost 9 out of 10. 9 out of 10 people are not at optimal metabolic health in our country. And then to further that, it's not just having some degree of insulin resistance. 3 out of 4 adults over the age of 65 has prediabetes or type 2 diabetes. So clearly, we have a public health crisis in this country, but I believe worldwide in large part, especially in developed countries, because we're not doing the things that we need to do to age well and to have longevity and quality of life. So this is really important. One of the reasons why this is happening, don't ask me why this is happening. Don't ask me why they did this, but this is what they did, was in 2023, the American Diabetes Association updated their standards of care. And they said that if an aging adult, so an older adult with few chronic illnesses, so they're not that sick, and intact cognitive function, so they don't have dementia, they said it's okay for them to have an A1C of 7 to 7.5, which is diabetic. So they're saying it's okay to be a little bit diabetic. That's all right. And that's why doctors are ignoring it. There's really there's a lot of money in people being sick regarded big medicine, big pharma, big food. And I think that's another issue, not getting into that today, but just from a personal bias standpoint. This is the next thing that we're going to be talking about here. If you have prediabetes or diabetes, which you do because you're here, or if you're just here for someone else to help them, that's great too. You definitely have insulin resistance, but how many more signs do we have? In your workbook, I want you to add them up and then type in the chat just how many signs you have. So for women, a waist circumference over 35 inches. For men, it would be 40. Blood pressure, 130 over 80 or higher. Fasting blood sugar over 100. Triglycerides over 150. HDL under 50 for women or under 40 for men. Fatigue, especially after meals, that's a sign of a blood sugar spike, is getting really tired. Bloating and water retention. Increased hunger and sugar cravings. Increased thirst or frequent urination. And mind you, as we age, sometimes we need different medications. Like my aunt's taking a medication and it's really causing like a ton of dry mouth right now. That's not this. This is not medication side effect stuff. This is just general stuff. Frequent infections, skin tags, which are just like usually around the neck, but they can be anywhere. Acanthosis nigricans, which is like a thick, velvety, dark skin, and it's common around the neck or in skin folds, like under the breasts or the armpits. Numbness or tingling in the hands and feet, and difficulty losing weight. So there's 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 signs and symptoms of insulin resistance. I'm just going to stop the share and look in the chat quick to see where we're at on that. 8, all 6, 1, 5, 6. Yeah. Do you see what I mean? When there's like a cluster of things. You're not imagining it. This is insulin resistance. And when you treat it, the beautiful thing is all of these things should improve. Yeah, you're welcome. Hmm. Yeah, and I think that a lot of doctors practice in silos anymore. So they might not view it from the system standpoint of insulin resistance. It's like if you have a joint problem, you're going to ortho. If you have a neurological problem, you're going to go to neuro. If you have a metabolic problem, you might go to endocrinology. So I think that when medicine is practiced so siloed, we sometimes miss the bigger picture of what's going on. Okay. Let's talk about menopause a little bit. I know not everybody here is female, but many of you are. And so it's important to talk about that when we go through perimenopause, our progesterone and our estrogen are kind of fluctuating a lot. And then menopause is when you haven't had a period for a year. And the thing to recognize is estrogen is an insulin sensitizing hormone. And when our estrogen tanks, after menopause, we lose that insulin sensitivity. So we need more insulin to get the same effect for blood sugar, for blood pressure, that kind of thing. Another thing that's really important to recognize from a weight standpoint is estrogen is not just a reproductive hormone. It's important for your cognition, for your bones, for your muscles, everything. And so your body still needs to produce estrogen in some capacity, but your ovaries have tapped out. So your adrenal glands that sit on top of your kidneys and your adipose or your fat tissue pick up the slack. Okay. So that is why I like to say after menopause, fat is like the boardwalk on the Monopoly game. Like your body will not want to give up your fat tissue because it's producing estrogen. Now it's more valuable, just like boardwalk on Monopoly. It's the most valuable property. The other thing is your adrenal glands producing that estrogen, those also produce stress chemicals and stress hormones. And so if your stress is high in midlife, that's already taxing your adrenals. Your fat tissue will become even more valuable because your adrenal glands are so busy producing stress chemicals. Um, and that's why stress management really becomes crucial and why I'm so passionate about emotional brain training and really helping calm the nervous system so that your body feels like it's safe to release the weight and your brain feels like it's safe to release the weight. But that's what's going on. Your insulin resistance is going up in midlife because your estrogen has come down. So we have to compensate for these natural hormone changes with targeted lifestyle interventions. One of them is increasing dietary protein. Another one is strength training. Muscle mass becomes really, really important to preserve, especially in midlife. Okay. And for glucose regulation as well, just think about like your muscle mass as a garage. Okay. And the cars are the glucose. So the larger garage space you have, the more your glucose, the more cars you can fit into the garage without them spilling out into the driveway or the bloodstream. Like the driveway is the bloodstream. Okay. So the more muscle you have, the more carbohydrates you can eat and still have a healthy blood sugar level. That's the simplest way to think about it. So let's go. Well, what causes this? Let's look at it. Okay. Aging and menopause are a given. Are a given. If you go through menopause, you have a greater chance of getting insulin resistant. As you age, we have a greater likelihood of developing insulin resistance for many reasons. For example, going back to this chart, testosterone drops, so muscle mass becomes harder to maintain. Cortisol rises and melatonin drops, making good quality sleep harder to come by. And our muscles restore themselves when we're sleeping. So we have to do things to compensate for that decline in muscle mass to protect our metabolism. So let's look at these. Write in the notebook which ones you struggle with. So there's 10 of them. Eating refined carbs and sugars, not eating 1 gram of protein per pound of ideal body weight a day. We're going to talk at length about protein goals and needs tomorrow. If you don't understand what that means, that's okay. If you just think, oh, I'm probably not eating enough protein, you can check that one. Eating frequently throughout the day. Eating after 7 p.m., your body actually gets less efficient at processing food, especially carbohydrates after 7. So if you have like a chocolate chip cookie at noon, that's going to be better for you metabolically than if you have it at 9 at night. Just saying. Physical inactivity, not strength training, poor sleep quality or quantity, high stress. Some medications can contribute to insulin resistance, like some from like statins, for example, which are overprescribed. And we have a lot of content in our Zibly course about cholesterol and how to communicate with your physician to see if a statin is really appropriate for you. Because if it's not, it can cause some side effects. I know one family member took them and lost hair. Another family member took them and had really bad muscle aches and cognitive issues, and it can contribute to insulin resistance. So the fewer medications we can be on, the fewer the risk for side effects of those medications and the better. Some like beta blockers for high blood pressure can contribute to insulin resistance, which stinks because if insulin resistance caused your blood pressure or your high blood pressure, and then you're taking a medication to make that insulin resistance worse, you can see it's kind of this spiral with medications. Some depression medications can contribute to insulin resistance, and then transplant medications. If you've had a transplant and you have to take something to prevent rejection. Lastly is inflammation, including from refined seed oils or excess body fat. Just excess body fat in and of itself can release inflammatory compounds. So 1 through 10, check them off in your workbook. And I want to know for you what one habit is the hardest for you. So you might struggle with more than one, but if you had to pick one and be like, I've tried so hard to work on this habit and I cannot gain traction with it. Let me know in the comments what that is for you. You guys, by the way, you're doing so great interacting. I love going back to the chat and seeing, oh, 76 new messages. That's fantastic. Eating or snacking. Yeah, horrific cravings for refined carbs. Eating frequently. Some people are just putting the number, which is fine, but I didn't have the slide up. Eating after 7, stress. Cravings, a lot of food cravings. Okay. Some medications, refined carbs, stress eating sugar. Yeah, you guys, there's so much hope for you. I'm so pumped for the second part of this training. I think it's going to be so eye-opening for you to see how stress and cravings and eating at night and emotional eating all come into play. I'm so excited for you. Wow. Okay. Great. Great responses, everybody. Keep it up. All right, that's what we have for the strategy for today. Tomorrow, this is our preview for tomorrow. Again, we're going to talk about blood sugar spikes so you understand what's causing them and how to minimize or avoid them. Tomorrow is a big day. So come excited, come prepared to learn. We're going to learn more about macros and how to structure your meals in a way that reduce blood sugar spikes. We're also going to calculate your personal macronutrient and calorie goals, and then learn tips to enjoy carbohydrates without the spike. That's the strategy stuff for tomorrow. Again, just to kind of give that bird's eye view, what are we doing here? If you have a brown spot in your ceiling, we can think of that as having high blood sugars. That's a symptom of a leak in your roof, insulin resistance. Okay, so we need to fix the root cause because insulin resistance can be prevented and it can be reversed, and it can happen pretty quickly. Now we have to get to this part. We really need to fix the root cause of the root cause. And stress circuits are the root cause of insulin resistance because they drive your behavior. We're going to talk more about this, so if that was confusing, don't worry. But I want you to start thinking about insulin resistance as the symptom now. So blood sugar was the symptom. We know insulin resistance causes high blood sugar. And I'm here to tell you stress circuits in your brain are causing the insulin resistance. So I can give you strategy all day long. I can tell you exactly what to eat, and I can almost guarantee you're going to struggle to follow through. And that's because of our brain wiring. So we have to focus on rewiring our brain if we want lasting, meaningful results. Let's get into the EBT teaching. EBT stands for emotional brain training, different from the thinking brain, as you're going to learn. And there's 3 parts to this emotional brain training process. Step 1 is self-regulation to increase joy and stress resilience. Doesn't that sound wonderful? It is wonderful. I can tell you it's so wonderful. Number 2, rewiring stress circuits into joy circuits. So you have to kind of grease your stress resilience pathways so that you can go deep enough in your brain to find the circuits that need rewired that are causing chronic stress and maladaptive coping behaviors like turning to sugar, eating at night, those things. And you can't rewire what you can't find. So that's why we have to do self-regulation first, so that we grease our pathways so we can find the wire. And then the last part, they're called advanced kits. And there's one for each higher purpose reward of sanctuary, so peace and power from within, authenticity, feeling whole and being genuine, vibrancy, healthy with a zest for life, integrity for doing the right thing, intimacy for giving and receiving love, spirituality, however you define it, and then freedom, a life of joy and purpose. And there's like a 30-day kit for each of those to strengthen those joy wires, to clear emotional clutter blocking you from experiencing joy. It's been incredible. I could talk about EBT forever in my own life. I learned EBT because I'm like, oh yeah, this will be really helpful for my clients and I can help them stop stress eating. And then little did I know it would transform my marriage and my parenting. It would make my healthy eating habits so much easier. Like I don't feel like I'm white knuckling things. So it's been a blessing to me and I hope it's a blessing to you as well. Now we're going to get into the experiential part of this, okay? So this is called a check-in. This is going to feel so good. And it's to calm your stress and improve your biochemistry in just a minute, like 1 to 2 minutes. That's all it takes, okay? I know you might not understand it all and you might have lots of questions, and that's okay. And we're just going to put those on the shelf for now. And what I want you to do is close your eyes. If you're taking notes, you can stop. Turn your attention to your body and your breathing. Take a deep breath in through your nose and out through your mouth, or in any way that feels really comforting and comfortable to you. And because we just learned so much and we've been intense, let's go ahead and do that again. Take a deep breath in through your nose. And sigh out through the mouth. And then go ahead and put your shoulders back and your chest out. Lift your chin slightly, and I want you to bring a warm smile to your face, like you're thinking about someone that you love. Crinkle the corners of your eyes a little bit. And warmly observe yourself. See yourself sitting in that chair right now in the present moment, just as you are, with all of your challenges, your struggles, your joys. Feel a wave of compassion for yourself. And then ask yourself, what's my number? Am I at a 1? Am I feeling great right now? Am I present with a glow? Would I rate my stress at a 2? I'm feeling good. I'm present, but I don't have a glow. Is your stress a 3? A little stressed. Some scattered emotions going on. Are you at a 4? Definitely stressed with stuck emotions. Or are you at a 5? Totally stressed out, or you might be just numb. You can be numb at a 5 too. Take all the time you need. I'll repeat those one more time. 1 is feeling great. 2 is you're feeling good. 3 is you're a little stressed. 4 definitely stressed, and 5 stressed out. Lastly, take a moment and just deepen the connection to just the deepest part of yourself, that sanctuary within you. And I want you to feel your capacity, that unending capacity for love and compassion and ultimately joy. Take one more nice deep breath. And I want you to recognize if you feel a little bit differently than you did 2 minutes ago. Do you feel lighter, less stressed? That's a sign that you just changed your biochemistry without medications in minutes. You just let healing chemicals surge throughout your body to change every single cell of your body on a biochemical level. And it was very simple. I want to know your number. What's your brain state? Let's write it in the workbook. Type it in the chat. I don't know about you. Part of me is like, I don't want to come out of that check-in. That felt really good. So type your brain state in the chat. So again, at brain states 1 and 2, your thinking brain is fully online. At 1, you're going to feel great. You're going to feel calm, grounded, hopeful. Hope. Hope exists at brain state 1. So if you don't feel hope, that's a really good sign that you're not at 1. 2, your thinking brain is mostly online. You're feeling good. You can make good choices with a little effort. 3 is when your emotional brain starts to take over and you're feeling a little stressed. You might feel scattered, irritated, rushed, or overwhelmed. I was at a 3 before I did EBT. Now I'm at a 1. Number 4, your thinking brain is mostly offline. Your emotional brain has taken over. Okay, you're definitely stressed. You feel reactive with urges to cope, like eating food, drinking alcohol, impulse shopping, scrolling on your phone, checking out, etc. And at 5, your emotional brain is totally in charge. You are stressed out, you're in survival mode. It's like fight, flight, or freeze. So this might be where you're binging, you're snapping at others. Maybe you just totally numb out. I wanted you to have a really clear picture of what are these brain states, okay? I'm going to see where people are at today. It's really important for me to know where you're at. Oh, wonderful. Some ones. And guys, there's no bad brain state because we get to learn something from every single brain state. A lot of 3s. Yeah. Some 4 to 5. Yeah. Great. Oh, Elaine, blessings to you. Heart cath tomorrow. I hope that that goes well for you. Yeah. Great, guys. Isn't that powerful? Isn't that interesting to just be able to have a simple way to classify your stress, I think is really helpful because then you can do something about it. So I think one thing that is so interesting is you have a different emotional need at each brain state. So your need at brain state 5 is safety. Your need at brain state love is, at 4 is love. At 3 is comfort. At 2 is pleasure. And at 1 is purpose. And so if you are hanging out at brain state 3, it's likely that you're eating for comfort. If you're hanging out at brain state 4, it's likely that you're eating for love. At 5, you're probably eating for safety. So for me, when I found my food wires through EBT, mine was comfort and pleasure for sure. I had a lack of what we call natural pleasures. I work, work, work. I mom, and then I crashed. And I was like, eating was my only break time. That was my only time for me, my only pleasure. And when you raise your brain state by rewiring those stress circuits and raising your joy circuits and seeking natural comforts and pleasures, what does that do? That's internal dopamine that you just experienced. You just raised your dopamine and your serotonin and your oxytocin in 2 minutes through that check-in. Internal solution so that we can stop seeking external solutions from food, from alcohol, from the excesses. So I want you to write in the chat, and the workbook, I mainly eat for. What resonates the most with you at this point? Do you mainly eat for purpose, pleasure, comfort, love, or safety? Let's see where people are at. Oops. So eating for purpose would look like I eat for freedom and vibrancy. I only eat foods that make me feel good and healthy and don't cause blood sugar spikes like that. So eating for purpose is wonderful, and that's actually the only place intuitive eating works. Intuitive eating only works if you're at brain state one. Otherwise, your biochemistry is dysregulated to the point that your satiety, your fullness hormones are thrown off. And so you can't accurately sense when you're full if you're not at brain state one. Yeah, pleasure, comfort, a lot of, and that's to be expected, right? We saw a lot of brain state threes and twos coming in, so pleasure and comfort's to be expected. Yeah, Joe said safety, comfort and love, pleasure and comfort. Yeah, I can relate to a lot of those. Yeah. The other thing, guys, is it makes perfect sense too, because when are we most likely to emotionally eat? It is not at breakfast. I'm not sitting down to breakfast and be like, give me the sugar, give me the cookies, give me the ice cream. It's at the end of the day as stress has built up throughout the day. So your brain state might start the day at like a two, but then by the end of the day, you might be at a four. You're much more likely to overeat or emotionally eat if you're stressed out. And now that you know that, it's beautiful, powerful information. I want to tell you a quick story. We were at Thanksgiving, not Thanksgiving, my grandma's funeral this weekend. And obviously, we all probably have some family that stresses us out. And I was around some family that was stressing me out. And I realized I really wanted to go to the cinnamon rolls. And I did. And I went and I had half a cinnamon roll. I was like, oh, I'm definitely not at brain state one anymore. I'm not eating for purpose. Okay, what's stressing me out? And I had to identify that it was family that was stressing me out, and I couldn't change them, but I could change me. And so we just left, which was kind of unfortunate because there was other family there I really wanted to hang out with, but the stressful family, it's like I reached my limit. And so I went and we went back to the hotel and I did what's called a cycle that I'm going to lead somebody through here in a second to deal with that situational stress. And when we got back to the hotel, I was like, I really want chocolate. We had chocolate in the back seat because my grandma who had passed already had the Christmas presents and everything ready. So we had to take our Christmas presents and there was these little baker's chocolates from Nebraska. And I'm like, oh, I want that. Okay, I'm craving chocolate. Obviously, I'm not at brain state one. Let me do a cycle. And I did a cycle. I changed my biochemistry. I increased my dopamine naturally, and I didn't even want the chocolate afterwards. That's the power of these mindset skills. So, the thinking brain versus the emotional brain, this is really basic, but I wanted to give you this background as we build over the next 3 days. So, the thinking brain is located in the top front part of your brain. That's what we're all using it right now. Okay. It's logical, it's calm, you're thinking long term, you're being intentional with your choices. It's the wise adult part of the brain. And it's motivated by higher purpose rewards like the sanctuary. Um, Actually, I'm really interested. This wasn't a planned question, but I am interested. I'm going to say these again, and I want you to think about what reward is motivating you to be here today. Which one is most powerful for you? Which one is like lighting you up? Like, I want that. I want to improve my health for that reward. So, sanctuary, peace, and power from within, authenticity, and Beth can type them in the chat too, Beth. Feeling whole and being genuine, vibrancy, healthy with a zest for life, integrity, doing the right thing, intimacy, giving and receiving love, spirituality, however you define that, and freedom, a life of joy and purpose. What reward is most motivating for you to really master this information in your health? I know when I started EBT, it was sanctuary. I wanted peace and power from within. A lot of vibrancy, freedom, freedom. Yes, healthy with a zest for life, vibrancy. Great. Health. Yeah, so that's vibrancy. Yes, sanctuary, peace and power from within. The thing is, like, my health was pretty dialed in, but I felt really, and I would have told you I had a great marriage and great relationships with my kids. But for me, it just improved so much and my relationship with myself. So that peace, that power from within, that was so motivating to me. Thanks, Beth, for doing that. A lot of vibrancy. Yeah, some sanctuary vibrancy, and then yeah, you can say all of them. And freedom. Great. Okay, isn't that fun to think about? I just love those. I love those 7 rewards. So compare that to the emotional brain. That's going to be located deeper in your brain, literally. There, I didn't get into the anatomy today, but it's a different anatomical structure in the brain that takes over when your emotional brain is in control. And that is fast, reactive, and protective. Okay. It's the rebellious child part of your brain, and it's motivated by pleasure, comfort, love, or survival based on the brain state. So, thinking brain is in charge at brain states 1 and 2. Emotional brain is in charge at brain states 3, 4, and 5. And that is why you can know what to do and still not do it, is you're stressed out and your emotional brain is running the show. Again, your thinking brain only works when stress is low enough. That's why we say, I know exactly what to do, but I don't do it. It's not a willpower problem, it's a wiring problem. Okay? It's not willpower, it's wiring. Now, your brain state, I want you to think about it as a heart rate. It can change moment to moment. If I got a call that said my kid's sick, I have to come get him right away at school, I'd go to brain state 5 right now. But right now I'm at 1, so it can fluctuate. But we all have kind of a thermostat setting of our brain state too, and that's determined by what circuits are normally firing. And there's two types of circuits that we focus on. The first are stress circuits. Those produce disease promoting chemicals. Specifically, there's 8. We're going to review them on day 3. There's 8 weight regulating chemicals that get dysregulated. Insulin and cortisol are just 2 of them. GLP-1 is another one when you're in stress. So, for example, with GLP-1, which is a hormone that helps us feel full, when we're in stress, that goes down, meaning we eat more food and probably overeat because we don't have that satiety signal. That's why that intuitive eating only works at brain state 1. Your GLP is off if you're lower brain states. And that's also why when people tell me they're on, someone said they stopped taking Ozempic, if you're on a GLP-1, recognize that's only affecting one of the 8 major weight regulating chemicals that get thrown off if you're in stress. So we're not treating the root cause. I'm not anti-medications. I just like to go in them with eyes wide open on side effects, and like you still need all this stuff too. So joy circuits then, which we just strengthened through that check-in, produce healing chemicals: dopamine, oxytocin, serotonin, internal. Okay. Now, behaviors, this is so, so, so important to think about. If you get nothing else from this, I want you to know your behaviors are just the tail end of a circuit. So, stress circuits are the root cause of insulin resistance because they're driving you to do the behaviors that cause insulin resistance. And they have to be addressed if you want lasting results with your blood sugar and weight management. Okay. So, we change the circuit and then change the behavior naturally. Dr. Laurel Mellon is the founder of EBT, and often she'll say behavior change becomes effortless. And I always smile because I'm like, well, it took some effort to rewire the brain circuit, but it's true. And I can't believe when I started to experience, I didn't want sweets after dinner anymore. I didn't want to go have a little snack after dinner. It's like I could have strategies in place like chewing gum, drinking water, brushing my teeth, but it still felt harder than it should. And it doesn't feel like that anymore. So when you change the circuit, that's when the behavior change becomes really effortless. So this is a paradigm shift for many people because brain circuits that impact weight or insulin resistance or blood sugar, they're often formed during a traumatic time in early childhood or adolescence or during a period of stress overload as an adult. Okay. The point there is they formed without your permission. Your circuits were formed without your permission. And they fire without your permission because when you're at brain state 5, that's a reflex. It's an emotional reflex that I had to go get that cinnamon roll, to crave the chocolate. An emotional reflex is a symptom of a brain circuit firing. It's just a wire. Okay. It's just a wire. We can rewire it. And we're going to look into this a little bit more. So it's not like we're going to dig into your childhood or your trauma or stuff like that. It's just kind of a nice big picture overview of your own stress circuits and your opportunities for rewiring. We're going to do that on day 3 with a brain map together. So again, I really want to emphasize this is not your fault. Your behaviors are just evidence of your circuits. And it wasn't very long ago that we didn't even know about that. And we didn't know how to change circuits. There wasn't a proven scientific method to do so, and now there is. You are not the problem, and you're not a failure. Okay. How could you change something that you didn't even know about? So if your insulin resistance is caused by stress circuits and you didn't know about stress circuits, you can't really hold this against yourself. Okay. New information, beautiful information, but it's just new. So this is Dr. Mellon here, founder of EBT. She took 40 years to develop the method. There's 14 research studies behind it. It's really simple and beautiful. She says, trying to change your behavior without the tools to lower stress so you can change your behavior is called suffering. It's called trying again on Monday, yo-yo dieting, trying everything. Okay. So trying to change your behavior without the tools to lower your stress so you can change your behavior is called suffering. So what happens with GLP-1s? This is prediabetes and weight loss is what they studied here. 68 weeks of treatment, they saw a steady decline. And then they studied the people for 52 weeks after treatment and rebound with both weight and blood sugar. Okay, that's what happens if you don't change your lifestyle at the same time. Again, 40 years of research, 14 studies to refine the method for substantial lasting results. This is 5 years after treatment stopped. EBT, I would say, takes about, it's not like it takes up your entire life, but I would say most people like really intensely learn it, get through the advanced kits in about a year, and it lasts. Like there's not the V rebound. So when you combine that with a strategy that keeps insulin low, I promise you, like your success is just a matter of time. It's inevitable when you really lock in both the strategy and the mindset tools. So the big picture, we're almost to the coaching. So hang in there. You're doing great. I want you to write this in your workbook. Obesity and diabetes are not behavioral problems. They are biochemical problems caused by stress circuits. The stress circuits dysregulate 8 hormones that make you want to eat junk food, that make you overeat, that make you want to be inactive, that disrupt your sleep, that then cause insulin resistance, which results in high blood sugar. The opposite of stress is not relaxation. It's creating joy. And that is something that you can create actively in your life because when we have joy, we're at optimal biochemistry. It's great. And the other thing is we need emotional strategies. We got to fight fire with fire. Thinking strategies or cognitive behavioral therapy techniques, they're not going to work to rewire your brain. Okay. We need the emotional strategies. I'm not against the cognitive behavioral therapy and the counseling. It's for a certain brain state. Those methods, like the book Atomic Habits, for example, is amazing, amazing. But those strategies are only going to work if your brain states 1 and 2. So that's why we need EBT. We can go from brain state 5 to 1. Again, we're going to review one tool today, but there are tools for each corresponding brain state, which is really helpful. And what you do is you calm the emotional brain, you bring your thinking brain back online. You're going to rewire stress circuits that trigger overeating, cravings, and self-sabotage. So the 4 big circuits, which is like that step 2 in the EBT process, if you remember, your food, your mood, your love, and your body circuits. When that happens, you're going to feel like, oh my gosh, I finally know why I do what I do. And I know where that comes from and I know how to fix it. So you're going to naturally have more peace of mind. It's really not about being perfect because that's not authentic, right? And authenticity is one of those 7 rewards. It's just about rewiring your brain to be at joy, be at brain state 1 so that you can do what you want to do without white knuckling it. So that's what we covered today. I'm not going to really review this super in depth, just very briefly. We covered why insulin resistance is the root cause of prediabetes, but also why stress circuits are the root cause of insulin resistance. You identified, are you pre-diabetic? diabetic or do you have normal or optimal levels? How long have you been in that range? And we talked about emotional brain training quite a bit, just some background. So tomorrow we're going to get into more of the nutritional side of things with calories and macros. We're going to give you some tips to enjoy the carbs without the spike and a really, really good meal planning tip. And then getting into more of the essential pain and earn rewards, that internal tug of war. I think I have a slide about that coming up. Yeah. Your internal tug of war of I know what to do, I'm just not doing it. So this is current you. And subconsciously, there are earned rewards for not changing. And there are essential pains of changing. And then future you, or, you know, um, the you who has reached your goals, they're motivated by there's earned rewards for changing. And there's essential pains of not changing. And that language might be a little bit confusing right now, but that's okay. We're going to get to it tomorrow. But this is a real thing, this internal tug of war. We're going to really confront that head on. I want to hear from you. We covered a lot today. We covered again strategy, mindset. I want to know, what was your amazing learning? Was it about insulin? Was it about EBT, your brain state, something really specific, really concrete that when you tell somebody about this training, that's what you're going to tell. Oh, I learned this today in the training. What did you learn? Write it in the workbook, type it in the chat, and then we'll get to the coaching. Great job on the messages. Okay. Yeah, how emotions affect your chemistry, brain state, and stress. Wonderful. Yes, EBT is a powerful tool. That I exchange food. Oh, how powerful is that? Yes. That I exchange food, sugar for joy. It's just chemical. It's biochemistry. You're getting dopamine either from joy or you're getting it from food. Yep. Yeah, brain states. And then I'm in a 3 to 4. No, you don't have to be at the live to get the replay video. Thanks for answering that, Beth. Mm-hmm. The opposite of stress is joy, not relaxation. That one hit me hard because I love watching TV at night, cuddling my husband just to check out and relax. Yeah, how much insulin affects so many aspects, how estrogen plays a role. Guys, you are so great. Wonderful. So good. Oh, I'm glad that this I want to know if that person was serious. I guess I should stop juggling swords. I don't know if you guys saw that comment. That's their amazing learning. That does sound a little bit stressful. Great. Yeah, Lisa said, I knew stress contributes to insulin resistance, but I didn't know about all the hormones that contribute. I was only aware of cortisol. Yeah. hmm Oh, there is so many good things waiting for you guys. Thank you for sharing those. Love, love, love hearing all of them. Keep them coming in. So what we're going to do, I thought I don't want the benefits of today's training to stop today. I really wanted to give you a tool that you can use into the holidays. So emotional brain training, there's something called the Spiral Up app, and that's paid, and that's not what I'm talking about right now. This is the Spiral Up Lite app. Okay. So it's teal. And if you know how to download an app on your phone, I want you to do this. Otherwise, come back to this part in the replay and have a loved one help you download the app. And once somebody downloads the app and they want to do coaching on some situational stress that they're experiencing right now, let me know. This is like when I had to leave my grandma's house because family was stressing me out too much. This was the tool that I did when I got the call. I just have to share something personal with you guys. My grandma died like a week and a half ago or something. And my mom was back here. It's my mom's mom. And they'd been her and her sister-in-law taking turns caring for Nana 24/7 supervision for about a year. And my mom just happened to be back on this end of the state when Nana fell, had a stroke, that kind of stuff. So my aunt called me in the middle of the night and she's like, I can't get a hold of your mom. I'm taking, like, they took her to the ER. We're gonna get a CT scan. So then she called me later. She's like, I think you need to go over to your mom's house and wake her up and bring her to this side of the state. Because we didn't know she'd make it through the night. And I cycled so much in the half-hour drive at 3 o'clock in the morning from my house to my mom's house. So the tool that we're going to use right now, I got my anger out, I got my grief out. There's more, but it allowed me to go into my mom's house, cool, calm, and collected, wake her up in the middle of the night, say, "Your mom fell. We don't know if she's making it through the night. We need to go now. Pack a bag. We have to go right now." Drive 5 hours across the state of Nebraska and be her rock. Be exactly who my mom needed me to be in that moment. Be an emotional buffer between her and her brother. I couldn't have done that without the tool that I'm about to teach you. I would have been scattered. I would have been at brain state 3 or 4 or 5. And she needed me at brain state 1. And that's really the power of this connection piece and learning EBT is you borrow someone's brain state. You know, when you're around someone and they just have a good vibe about them and they're joyful and they're positive and you leave and you're like, my cup feels full. Like that person is so good for my soul. I feel really good when I leave that person. You borrowed their brain state. They were at a higher brain state. They lifted you up. You've also been around people who drag you down, who stress you out. They're at a lower brain state. So we have to get really good at being the thermostat, not the thermometer in the room. Be the thermostat, not the thermometer. Be that person that other people want to be around to co-regulate. Like that's the power of EBT. That's what we're going to learn. So download that app, and once you've done it, if you want coaching, you can type, yes in the chat or I want coaching or something like that. I want to do it over some situational stress. So a family member is stressing you out. Maybe there's holiday stuff that you have to prepare for. Maybe you got some bad news. Someone's having the heart cath tomorrow. That would be a great thing to do a cycle about. Absolutely. So, Brenda, okay. First come, first serve. What's the name of the app? Spiral Up Light, the teal one, not the blue one. So let me just share my screen really quick to be sure that I'm not forgetting anything. Yes, perfect. So guys, here's what we're going to do. I'm going to coach Brenda. Brenda, you can come off mute. Actually, I might need to do that for you. Here we are. And we're going to do a cycle together, but I wanted you guys to download the app so that you could follow along because you should be able to reproduce this. Let's see. Brenda, are you able to request access to come off of mute? And I might actually be able to change that setting too. Because when we got started, I changed the settings so that you guys could not unmute yourself. Because who knows what kind of background noise we would have had. There we go. Brenda, you should be able to unmute yourself now.
Okay.
Oh, good. Okay. Thank you so much for being here.
Thank you for this. Been powerful.
Good. Hey, I just wanted to remind you too and get just explicit consent that you know this is being recorded and that you know that this will go on my YouTube and podcast for the next week and a half or so. Are you okay with that?
Absolutely.
Okay, great. So how this is gonna work, we're just jumping into it, okay? It's called a cycle. And this is perfect for situational stress. Whenever you have something stressing you out, whenever you have suppressed emotions that you need to clear, this is perfect to do that. Okay. So there's different lead-ins, and I will just take you through one at a time. I'm going to try really hard to keep you in your feelings. So there might be more silence than you're used to. Um, it's really cool. And we're going to go through all the range of emotions and we'll end in the thinking brain. And uh, the one thing that it's up to you, you can turn your camera off or you can leave your camera on. Sometimes you can go deeper into your brain if your camera's off and you're not really worried about like people seeing you scream or, you know, if you want to scream. I like screaming. I think it's when I have the chance, when my kids aren't around and I'm not going to scare them. Okay, so Brenda, we're going to start with the situation is, and you're just going to, like, if I was your friend and you're calling me on the phone venting about what's going on, that's the situation. About 5 sentences, just the facts, No feelings. The reason I don't want you to say, I feel really sad about this, or I feel really afraid about that, or I feel really stressed about this, is when we talk about our feelings, that's like pulling the escape valve in our brain and it releases the stress, which is what we want, but not yet. So the cycle works like this. We're going to ramp up the stress all the way through the anger procedure so you can get as deep in your brain as possible. And then we're going to come out on the back end of it to lower your stress. Does that sound good, Brenda?
Yes.
Okay,
Yes.
great. And at times, if I feel like you're in your thinking brain too much, is it okay if I just interrupt you to bring you back into your emotional brain?
Yes, please. Thank you.
Wonderful. Yes. Okay. So, Brenda, the situation is, go ahead, complain like you're 4 years old.
The situation is that I have lost a lot of um, bone in my jaw. I have to have dentures. Actually, I do. But they have gotten down so bad that even using uh, the adhesive is not working. So I went to see another dentist. Um, and of course, it's very expensive to get new ones, and I'm getting new ones. The Canada has just come with a dental plan. They pay huge.
Oh, you're cutting out a little bit, Brenda. Oh, she might be coughing too. She went on mute. So give her just a minute. There
So
we go.
yeah, so the dental pay plan pays for a big part of it, but I have to pay for the others. So I've had to ask help from my son, and he's been so good, and he said yes. So this has stressed me out a lot.
Good. Wonderful. Wonderful. What I'm most stressed about is, so I want you to connect inside and repeat. What I'm most stressed about is, and then pause and let the words bubble up about 5 words.
What I'm most stressed about is feeling like a failure, not having enough money.
Okay, so we're going to say feeling like a failure. I feel, and then repeat after me. This is the anger procedure. We're just going to ramp it up. I feel angry that I feel like a failure.
I feel angry that I feel like a failure.
I can't stand it that I feel like a failure.
I can't stand it that I feel like a failure.
I hate it that I
I,
feel like a failure.
I hate it that I feel like a failure.
God, I hate it. I hate it. I hate it. I
I
really,
hate,
really, really hate it.
I really, really hate it. I really, really hate it.
I want you to stay in that anger. It sounds like it's already shifted to sadness. When it's shifted to sadness, let me know.
Yes.
Stay there. Ah, take a nice deep breath. And when you feel connected, let me know when you're ready for more. Take all the time you need. You're doing beautiful. This is a safe place. You're doing beautiful.
I feel better.
Wonderful. Okay, the next lead in is I feel sad that the loss to me about feeling like a failure is I feel sad that
Um, I feel sad that having had diabetes for so long, and I've tried so many things. Oh, thank God I have come to a place that I'm going to get results, but I feel sad that I have lost so many years.
Mhm.
So many years.
Stay in that. That's beautiful. Just feel that sadness of losing so many years. Feel that grief, feel that loss, and let me know when you're ready for more, but feel it as long as you need to until it fades all the way. Stay with it.
I feel better.
Mm, wonderful. The next lead in is I feel afraid that. So if I don't resolve this, I feel afraid that. If I don't resolve feeling like a failure, I feel afraid that.
Uh, I feel afraid that if this doesn't work, uh, because right now the bone density is so bad. Uh,
Wait just a second. Stay in your emotional brain. So
okay.
we're going to say, I feel afraid that, and then pause and let the words bubble up. I
Okay.
feel afraid that, and pause. Give it a
Oh,
good 10-second pause.
okay. I feel afraid that I will have to just live on pablum type food. You know, I won't be able to chew my food, which
Mm-hmm.
is difficult already.
Stay in that and let me know when you're starting to feel more connected, when you're ready for more. Stay in that fear. Just feel that fear until it fades. It will fade. You're doing beautiful. Stay with it.
I feel better.
All right. Brenda, I want you to sit up nice and tall. Put your shoulders out. Lift your chin up a little bit and bring a smile to your face, even if you have to fake it. That's going to give your body, your brain, the message that you're in a state of well-being. And with a powerful voice, I want you to say, hey, everybody,
Hey, everybody.
I do have some power here.
I do have some power here.
I feel guilty.
I feel guilty.
Why don't I just do the logical thing
Why
and,
don't I just do the logical thing?
and then wait for the answer to come up to your mind. Listen to your body.
Just go with what the universe has brought me so far, which
Mm,
is um, I put it out there, and here I am getting this free
mm, 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 mm,
program.
receive maybe what about like receive help? Why don't
Yeah,
I
and
do the
I'm
logical thing and
receiving,
receive help?
yeah, I'm receiving help through this program.
Wonderful. I feel grateful that is the next lead in. So I feel grateful that
I feel grateful that this new dentist is going to help me to get a good pair of dentures.
I feel happy that
I feel happy that I have been heard by the universe. The universe hears me.
yeah. I feel secure that
I feel secure that this is going to help me do the work and the purpose that I was called to do. And believe it or not, it is to help people who have type 2 diabetes. And
Oh,
I felt inadequate to do
mm.
it.
I believe that. I feel that. I feel that in my body that that's true. And I feel proud that.
I feel proud that I have stuck to this, that I didn't give up, that I'm resilient, that I've taken every single step that I knew how to get to this place. Thank you, God. Thank you, doctor.
Yes. Okay, the next one is I expect myself to do the best I can too. So what is the the reasonable next step to take? So given all this, I expect myself to do the best I can too.
Um, to go ahead, first and foremost, to take care of myself by getting these new dentures.
Yeah, I expect myself to do the best I can to take care of myself and get these new dentures. My positive, powerful thought is, and this is something real simple like, this matters to me, or I can do that, or it's the right thing to do. So, my positive, powerful thought about taking care of me and getting the dentures is
It's the right thing to do.
the essential pain about doing that. It could be it takes work, I'm not perfect. I'm not in complete control. I must receive the help or receive the money from your son. I must give. Does any of those resonate as the essential pain of taking care of yourself and getting the dentures?
I must receive money from my son.
That's the essential pain. But my earned reward is, so I'm going to repeat them again. Your earned reward for accepting the essential pain of receiving money from your son so you can take care of your health and get the dentures is it sanctuary, peace and power from within? Is it authenticity, feeling whole and being genuine? Vibrancy, healthy with a zest for life? Integrity for doing the right thing? Is it intimacy, spirituality, or freedom?
Oh my goodness, there were so many in there. I can't
For all
remember.
of them. Sometimes it's all of the essential pains or all of the rewards. Yeah.
Yeah, yeah, yeah.
Great.
Thank you.
If you
Yes.
had to pick one, but if you had to commit, okay, my earned reward that's motivating me the most is
Uh, I think feeling safe. Is
hmm,
that part of it?
the sanctuary, like the peace and
Yeah.
power within.
Yes, yes, that's the
Mm.
one.
Yeah, great. And something practical like being able to chew my food and take care of my health. Like that's an earned reward for sure.
Yes.
So Brenda, I would just love to give a connecting message. So, connecting messages in EBT are given to enhance the dopamine effect. And then, if Beth is still here, my team member Beth, I would love for her to give one as well. Brenda, when you did your work, the feelings and sensations in my body were, oh, sadness and uncertainty and connectedness and serendipitous or serendipity, however we want to say that. And gratitude and joy. And the way your work was a gift to me was just a shared sense of humanity that we all struggle with similar feelings and also just how powerful the tools can be when we use the power of the pause to feel our feelings. So thank you for that. Beth, are you still on here?
I am still on, but I was answering a lot of questions, so I'm gonna pass.
Okay, thank you. And that's
Yeah.
great limits. So how are you feeling now, Brenda, after doing that cycle, receiving the connecting messages? How are you feeling now?
Oh my goodness, so much better. I feel
Oh, will you turn your camera back on too, just so I can see you? Thanks.
okay. Uh,
There we go. Hi. Okay, good. You're
Thank
feeling
you
better?
so much for this. Thank you so much. I feel heard. I feel felt. I feel understood. I'm grateful. Thank you.
It's a blessing to me, honestly. And thank you for saying all of that. What was the most important thing that you learned from doing that together?
I feel so accepted and loved. Thank
Thank
you.
you.
Thank
Oh, my pleasure. And I think it was a beautiful thing too. Um, it's a lot easier to think about our pain and our problems than to feel it. But until, if we can feel it, then we can heal it. So we can think about our problems till we're blue in the face, but it's not really until we feel it, just like you did, which is so beautiful, that our emotional brain can kind of move on and clear the clutter. So that was a really wonderful example. I'm so grateful that you were open enough to do that. And it's the power of EBT, guys. So I hope that you enjoyed that. I wanted to open it up for questions now. Thank you so much, Brenda, and good luck with the dentures. I hope that they really work out well for you.
thank you.
Of course. So I'm going to go to my Q&A doc, or if Beth, if you want to hop in here and hop off, whenever you need to. I know Beth has been probably answering questions like a madwoman, which is great. Um, Before we get into the strategy stuff, um, I wanted to just ask if there's EBT questions about what we just did or what you just saw. I want to keep it safe, so I don't really want you to comment on Brenda's work because that might not be safe for her. But if you have any questions about the work, then that would be great. So if you have any of those, you can raise your hand, put I have a question in the chat, anything like that. Um, Multiple Samsung users are saying their phones are too new and not compatible with the spiral up light. So they are coming out. You guys, I've had lots of conversations with Laurel. I do know for a fact that like a new apps version is coming out in the next week or so. So what we can do is we will put together a PDF on the lead-ins where I can take a screenshot of my phone and I can organize that like in a picture. So even if you just like want to keep that in your wallet so that you can go through the lead-ins without the app, you can do that. And I will email that with the replay today as a workaround there. And I want to know more about the effects of statins. That's a great question. We have, if Lori, that's who said that. Lori, if you want to email support@zibly.com and ask for that information, we have kind of an email that we send out if anyone wants more info on statins. Same goes for anyone else. Kendra, just be prepared for that influx of emails on statins if people want more information on that. And because there's different resources, it's not really a simple explanation, but we link out to a few videos and give some background there. Patricia said, what should I do when I have to eat dinner after 7 p.m. after the gym? Um, it's kind of a personal thing, but if you could eat like dinner before the gym at all, do that and then just have like a protein shake or something after the gym, depending on the workout. If you're doing like walking or light yoga, you really don't even need to eat after that. But if you're doing more like intense exercise or strength training, getting a dose of protein after can help with muscle recovery and repair. But then the other thing is, you got to do what you got to do. So if you need to eat dinner later, see if you can shift breakfast to later in the morning too, so that at least you're getting like a 12-hour fast during the day is a great starting place. Okay, Beth, if you want to come off of mute and let me know if I missed anything or anyone, that would be great.
I think you're good.
Okay. I also just wanted to give a special shout out to all of my team members. Beth is on vacation with her family. Are you on the beach right now, Beth?
No, we were at the beach this morning. I am out on my in-laws patio right now.
Perfect. Well, thank you for being here and helping out so much. I really appreciate it. Kendra, thank you for being here. Betsy, I don't think Lydia was here today. I think she's still on holiday break, but I really appreciate every single person who was here. I hope that you learned a lot today. Tomorrow is going to be great, so be sure to come back. And if you have any follow-up questions, you can email us at support@zivly.com. I will be working this afternoon to get the replay up and the screenshot page as the workaround to the app so you can have the lead-ins of that situational stress management tool. Okay. Anything else that I need to wrap up? I see some
Yep,
people oh, sorry, go ahead.
there are a couple that just rolled in. I'm trying to type, but when you end it, I won't be able to type fast enough. So if you
Yeah.
want to answer those, you can.
Okay, just a second. Yeah, and if people are just coming in, we're just wrapping up. So if there was there might have been like a time zone difference. I'm not sure. Oh, sorry. I have to get back to the main chat. But a replay will be available if you missed the training. Oh, Cheryl, you are so welcome. Someone asked, how do I get the workbook? The workbook is in the email that we sent this morning or yesterday. Kendra or Beth, actually, I might be able to as well. Just drop the link, drop the Google Drive link to it. I tried to upload it directly in here and it was being a little pesky about that. But I can share the Google Drive link. Okay, here's the workbook. Thanks, Beth. Beth just sent that, so I don't need to. Oh, good, Betty. This is the best class. I tried. I told you, I'm like, I want this to be the best free training that you guys have ever experienced. So, all right, EBT close. We are creating joy and what in our lives today. So, Brenda, since you got the coaching, I would love for you to say what do you want to choose? We're creating joy and connection, joy and peace, joy and hope, joy and love. What resonates the most? What did we co-create during today's presentation?
Joy and peace.
I love that. Okay. So on the count of three, everybody come off of mute, first of all. So everyone come off of mute, and we're going to say on the count of three, we are creating joy and peace in our lives today. Why do we do that? It's all about the dopamine. We are raising our dopamine, so you're less likely to go eat sugar. And someone said, I hope you talk about when we need to eat more protein like meat, cheese, and eggs, if that will raise cholesterol. I can definitely add that to tomorrow. I will add a blurb about that and cholesterol tomorrow because we will be talking about protein a lot tomorrow. Okay, great. And then I saw a question about hypothyroidism. So Beth, just please kind of collect these questions and we'll be sure that we get them all answered before the boot camp is done. Again, email us directly if there's something you really need to know that I didn't cover today. So I see lots of people on mute still. So come off mute. On the count of three, we are creating joy and peace in our lives today. One, two, three.
We
We
are
are
creating
creating
joy
joy
and
and
peace
peace in
in
our
In
our
our lives
lives
today.
today.
Wow, what a wonderful time together. Thank you so much. I hope that you bless us again with your presence tomorrow. Bye, everybody.
Bye.
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 Bye.